Good morning, everyone. And again, a happy holiday season. Merry Christmas, Happy Hanukkah, Happy Kwanzaa to each and every one of you. Again, I'm very thankful to our lovely young ladies, sign language that are here. Thank you so much. And also to Dr. Kerouac, the President and CEO of Bay State Health Systems, and Dr. Robert Ruse, the Chief Medical Officer, Mercy Hospital, Trinity Healthcare, and Kim D'Angelo is a clinical supervisor who's pinch hitting for Patrick Leonardo for AMR in a partnership, and I hope Patrick's mom's doing okay also on that. We'll go into our updates. Total COVID-19 cases since the onslaught of this coronavirus is 8,763. This week we had 1,033, which is actually 135 less from last week, knock on wood. Monthly, though, we're already nearing the 2,000 mark. 1,937, 1,937. We did unfortunately have two more deaths of Springfield residents, one Hispanic, one white. And again, my thoughts and prayers and sympathy and encouragement go out to the affected families. God rest their souls. Total deaths now in the city of Springfield are 147. Of that, 63 are white, which is 42.8%. Black is 32, which is 21.7%. Hispanic is 48, which is 32.6%. Asian is 4, which is 2.7%. Long-term care facilities deaths are 58. Residential deaths have moved up to 89. Once again, our senior citizens meals home deliveries continue to our senior citizens who are in need. I thank Commissioner Helen Colton Harris and Sandy Federico and TJ Plant, my CFO, with Van Pool on that. Flu shots, obviously we continue to urge you to get your flu shots. That not only comes from myself, but the medical professionals of Dr. Kerouac, Dr. Roos, and Commissioner Helen Colton Harris. I'm sure they'll be giving you updates pertaining to the vaccine shots that are starting to come our way for the first wave. Stop the spread, Governor Baker, which we appreciate with AMR, the partnership continues at the Eastfield Mall. They will be making some announcements for next week as we move into the holiday week of when testing will occur, when it will not occur. I think that could be sometimes with a Wednesday, Thursday, or Friday of next week, because Christmas time most likely will not have, though I'm pretty sure they'll announce that. We had a nice weekend holiday event with Commissioner Clapper and our Springfield Police Department C3 Forest Park Unit, my brother and sister Elks, and Springfield Together, a great group headed by Attorney Neil Phillips, and the teachers from Washington Street School, White Street School, and Connect Ed, and we gave out about 600 stuffed holiday stockings at the Elks Park, and it was really very heartwarming. As you know, another project that people said would never get done in the city of Springfield is going to be accomplished under my administration. A new Civic Center garage will be on its way. This is a deal that we made. I can't thank Governor Baker enough with Springfield Parking Authority and the Mass Convention Center, and we're going to be moving forward on that. On the holiday season, we lit the menorah in historic Court Square. We also have the nativity scene there, and we did that with the Rabbis Kosofsky, the Yeshiva Academy. Again, my sympathy and thoughts and prayers. The Rabbi Kosofsky lost their mom last week also, and very sorry about her passing. Another heartwarming event we did was last Monday night, 85th birthday for Willie Mae Gatson, who I affectionately call the Pound Cake Queen. We did a drive-by car parade, birthday parade at the corner of King Street and Massachusetts Ave, and she looked fantastic, 85 years young. City Clerk's office is open. I want to thank everybody for their patience. An abundance of caution, we had to shut it down late last week to make sure deep cleaning was done, but they are open again. So to the public, thank you very much for your patience, and I know they rescheduled those appointments as we continue to try to keep City Hall and city activities open in a controlled and structured environment. 2 town halls will take place this week. One town hall, and Superintendent Warwick probably speak more of that, will be Tuesday evening at 6 p.m. We did it last time. I think we had, it was 5,000 or 7,000 participants or viewers, and this is how we're going to move forward with our schools, and we want the input of the public, and that's important. I'll also have my 3rd town hall meeting pertaining to the police and community relations. That'll be Saturday morning from 10 a.m. to 12 noon, and that will be involving Judge Roderick Ireland, the retired Chief Justice of the Massachusetts State Supreme Court. We want to hear from the public again. We've done a number of initiatives, but we also want to continue to hear from the public and work together. Any and all are invited, and we look forward to that. I'm honored. I was invited to attend Bishop William Burns' installation, which I'll be attending at 2 p.m. at St. Michael's Cathedral this afternoon. Another Springfield first. He brings his U2 style and his dog, Zoli, which will be a first in the Bishop's residence. We were speaking earlier this morning in a cabinet heads meeting, and I deeply appreciate Chairman Neal, Congressman Neal's continued efforts, and I believe you'll be probably giving us an update, cabinet head, sometime this week. But he continues to urge, as we continue to urge, some of the representatives or elected officials in Washington, D.C., to stop the bickering and get a plan, a stimulus, aid done. Residents are hurting. If you go to the food lines, food banks we have, in the thousands, businesses are hurting. Director Sheehan, my Chief Development Officer, Tim will speak about that. We put out every dime we can. So if they can put some partisanship aside and try to work in a bipartisan fashion, your public, our public, but your public is hurting. The residents and the business community, especially the small business community, they are hurting. And this bickering does no one any good, especially my residents and business community in the city of Springfield. So, again, to our federal officials, elected officials, please, let's get your act together. On the police front, Commissioner Clapprood indicates 14 are down with COVID-19. 7 are awaiting testing results. That means she is down 21. They made some more gun arrests and drug arrests in the Fort Pleasant Avenue area. They've taken down or off the streets nearly 200 guns since the beginning of the year. And lo and behold, the same old song, the same old dance. Fort Pleasant Avenue, the 2 arrests made there on guns and drugs. Individuals who defaulted on guns and drug charges, on warrants to go into court, who have been arrested and again were let out by our wonderful court system. And I'm not saying all, but the judges. This is what happens. New York papers, I think it was the New York Post, was reporting last week The politicians now all of a sudden are saying, what's going on? All these shootings, all these murders, all this crime going on. And they had to be reminded by, I believe it's Commissioner McDermott Shea, is it? Commissioner, they're reminded that, by the way, you changed the laws. There's no bail. Nobody's being held. We're arresting these same individuals 1 or 2 days after they've been let out again, committing crimes, shooting people, dealing drugs. I don't want that here in the city of Springfield. And I'm going to keep fighting tooth and nail when it comes to these types of letting out these repeat violent criminal offenders. We also, again, I mentioned the town hall. Commissioner Clapper and Commissioner Calvi indicate to me that the contact has started to be made on the COVID-19, the vaccine, for our brave and dedicated men and women in blue and our brave firefighters. So that is going to start, I believe, very shortly, the first responders. This will also be another first. Mr. Clapper has been very proactive and progressive. I believe we'll be the first in the nation. We'll be sending it out as early as today or as tomorrow. Artificial intelligence. This will do with protecting the health of individuals that unfortunately we have to arrest or are in custody, and this will monitor their health issues. If there's any health issues there, we'll give a warning ahead of time so the officers are aware of it. So we're very, very proud of that. Stay tuned. You'll have more specific information before we understand Springfield will be the first in the nation to utilize this artificial intelligence to make sure that health concerns with individuals under custody are taken into consideration and quickly. Fire Department, Commissioner Calvi indicates to me that he is down 16, and he has another 16 awaiting testing. So he's actually down 32, where the police department is down 21. 2 dispatchers are also down. Commissioner Calvi will speak to you about kitchen fires. They had a number of kitchen fires and cooking occurred this week, and he'll speak to you about overloading electrical circuits with the holiday season. And again, the vaccines for fire staff will be moving forward, I believe, very shortly. Schools, Superintendent Warwick indicates to me that we'll be probably surpassing 5 million meals served, breakfast, lunch, dinner, snacks, to our students and families this week. We are at 4,836,374. We dole out about 103,108 meals this weekend. And again, he'll speak about the town hall. Schools through Patrick Sullivan, Director of Facilities and Parks, and working in concert with Commissioner Helen Carlton-Harris, we continue to retrofit our schools to go above and beyond on COVID-19. The attendance rate is staying at 91.5%, and Superintendent Warwick and I did send a letter to DESE last week indicating our plan on how we're going to move forward, when and if, in the public health as we continue to retrofit our buildings, getting kids back into school at the appropriate time following public health guidelines. DPW, and again, Director Signoli and I want to express our deepest appreciations to the residents of the City of Springfield on a leaf collection and your patience. They're a little less than 2 weeks behind. They're going to continue to pick up the leaves. He is down 8, and those 8 in COVID are drivers, and that is affecting, and first priority is to make sure that the trash and recycling is picked up. So that is affecting the leaf pickup. They're going to continue. I'm sure DPW Director Chris Signoli will indicate also an update on the upcoming storm, which I hope the weather forecasters are wrong, but possibly could be 6 to 12 inches starting Wednesday evening, 8 p.m. Into Thursday. So with our plowing operation, so let's see what occurs or doesn't occur. Director Signoli indicates with the upcoming weather that construction will probably shut down Wednesday. Facilities and Parks, Director Sullivan is down 6 with COVID. He continues his team, the yeoman work, of retrofitting our schools and our city buildings. Carrier units, more are on the way. The I-waves are being installed, and cross-training is being done for all the team. Sear Arena looks like, in consultation with Director Sullivan and Commissioner Helen Carlton-Harris, will possibly reopen January 14th, knock on wood. We continue to stockpile and buy our PPEs and cleaning supplies. And I want to thank Eversource. Pats is working very closely, especially with our older buildings. Electrical aspects have to be upgraded, especially with about 4 of our older building schools. We're putting on these I-waves and carrier units, and Eversource has worked very, very well with us, and I appreciate that from Eversource. And that looks like we're going to continue into January, and hopefully we'll be done by March, but we'll see on that, but we'll continue through into January. On finances, the Chief Financial Administration Officer TJ Plant indicates to me we have lost $7.2 million since this ordeal has started. I'm down $2.3 million in FY21. We've spent, through deficit spending and grants to provide for our residents and business community, $17.5 million. Of that, 6.3 is deficit and written off to grants, and we're going to continue to go after every dime and get my hands on, whether through grants, CARES Act, FEMA, you name it, to make sure that we can continue to provide for the residents and our business community. Echo Dev, Director Sheehan will speak to you that state numbers indicate small business revenue was down by 47%. The mass growth, which Governor Baker put out 50 million, they already have 10,000 applicants. There's no way they're going to be able to cover up to the amount that they have. That's why the federal government needs to move ASAP. We've already expended 80% of my CDBG and CARES money. It's already been put out to the residents and the business community, so that's why we need the federal government to act yesterday. The Oasis Food Bank continues every Friday at Central High School. We're serving about 3,500 families up there with working with Sedesco and the Food Bank of Western Massachusetts. By the way, since Dan Rulier stepped forward, Rulier Builders, and we put out that call for the Food Bank of Western Massachusetts, is very generous, $25,000. Subsequently, another 12.5 came in from Crowley Associates, Mike Crowley and Kelly Fredette. Davis family, 12.5, and I think I announced, it was late last week, or the beginning of the week, another 25,000 came in anonymous, 75,000 since we put that call out, which amounts to 300,000 meals to families much in need. So we appreciate the continued generosity of philanthropic aspects of our business community. So with that, and as usual, after Dr. Kerouac and Dr. Roos speak and make their presentations so they can get back to their important duties at the Bay State and Mercy, we will subsequently take questions immediately for both Dr. Kerouac and Dr. Roos after their presentations. So with that, I will now bring up the Dr. Kerouac, the President and CEO of Bay State Health Systems. Thank you.
Thank you again, Mr. Mayor, for the invitation. Good morning, everybody, and thank you for the cooperation of your team, which has been unfailing through this crisis. COVID-19 is continuing to spread rapidly in our communities. There have been over 72 million cases across the world, 1.6 million deaths. The United States has had over 16 million cases, and today we will surpass 300,000 deaths. There are record numbers of new cases every day, 220,000 on one day last week, and deaths, over 3,000 each day. The deaths routinely exceed the deaths from 9/11 and the deaths from Pearl Harbor. So we truly are living through a historic and sad period in our history. Many states across the country are reporting hospitals at or near capacity, and many states are going backward on their rules for reopening, becoming more strict. Nearly all areas of the country are seeing rising case levels, and that is putting a strain on our testing capacity as well as our supplies of personal protective equipment. Massachusetts is now seeing 279,000 cases and over 11,000 deaths, roughly 4,000 new cases a day and over 40 deaths a day. That's 2 times what it was just a couple of months ago. Hampden County just went past 20,000 cases and is nearing in on 1,000 deaths. The rate of new case numbers in Hampden County places it number 3 among the 14 counties in the state. That's 59 cases per 100,000 residents. Hospitalizations are at a new high at 1,700 across the state. Hospitals in the east are nearing capacity in their regular med-surg beds, not their ICU beds. Bay State Health passed a certain milestone as well. We got to 160 cases this morning. 134 are at Bay State Medical Center. 26 are in our community hospitals. 17 are in critical care. The increasing numbers you are hearing about in our community hospitals is part of our COVID surge strategy to have the less acute patients cared for in the community hospitals. Current surge planning at Bay State Medical Center calls for 190 beds to be opened up for COVID patients if needed, with 32 in critical care if needed. We may be able to get another 100 to 150 in the community. I haven't shown this to you in a while, but let me show you our epidemic curve, and it shows a fairly clear story of a resurgence. See the peak here in April. The trough, a low of 8 cases back in early September, and then back up to 160. The highest peak was 180 back in April. So things are clearly increasing at an alarming rate. We're continuing to bring staff on board. I was happy to hear that about 17 nurses were coming off of orientation last week. This is really the thing that we are most working hardest on. Many others in the state are struggling with this issue as well. We've begun to test our inpatients at 0 and 3 days to keep the patients and staff safe. So we test patients twice to make sure that the first one wasn't a false negative. We're also offering testing more broadly to our employees. Our test positivity rate is 7.7%, roughly around the same of where the state is. And our testing capacity is expanding this week. UMass Amherst is beginning to accept more and more tests. They use the same system used at MIT. We also are rolling out some point-of-care devices that will increase our testing capabilities. We're now running multiple platforms, 5, I believe, which puts us at less risk for shortages of supplies. We have begun to infuse the monoclonal antibody that you may have read about in the newspapers. It is used for high-risk patients before they are sick enough to require a hospital stay. So we're infusing it in one of our centers as outpatients. And we hope that more people will avail themselves of that because it does reduce the amount of virus in the system and makes it less likely that people are going to get seriously ill. We're continuing to postpone elective surgeries and procedures when the delay will not harm the patient. We're keeping open our outpatient areas where there's no impact on hospital capacity or where we couldn't redeploy the staff. As you've all heard, the Pfizer vaccine gained FDA approval last week, and we expect the Moderna vaccine to be approved this week. I think it's a very exciting breakthrough. It is, I consider it to be the beginning of the end for the pandemic, and can't wait for it to really be there as far as the end goes. We expect our first shipment of the Pfizer vaccine tomorrow, and we plan to begin vaccinating on Wednesday. We are following the state and CDC guidelines regarding the sequence with which people receive vaccine. There is a graphic which you can see on mass.gov or our own website that shows you phase 1, phase 2, phase 3 in terms of who is actually getting the vaccine or who ought to get the vaccine. Phase 1 includes clinical and non-clinical healthcare workers doing direct COVID-facing care. That's the first priority. Further down the list are healthcare workers doing non-COVID-facing care. That group amounts to about 7,000 to 8,000 individuals at Bay State Health, so quite a few people to vaccinate. Others on the list include elderly and congregate living situations like nursing homes or assisted living. Those are being distributed through a separate pathway by the state. We will not have enough in our first shipment to do all who are in that first group at Bay State Health, all the direct-facing COVID caregivers. But we're told that there will be weekly shipments, so we're hopeful that we'll be able to catch up quickly and have everyone vaccinated by January. Remember, there are 2 shots 21 days apart. And there is some protection after the first shot, but complete protection occurs after the booster at 21 days. We are not requiring this vaccine, but we're strongly encouraging it. There are side effects that are frequent, including aches and pains, headaches, fevers, flu-like symptoms, typically lasting a day or so, around 20% of the time with the first shot, around 50% of the time with the second shot. So we are staggering the administration within a given unit so that we can maintain a full workforce there and everyone's not getting side effects at the same time. The side effects mean that you are reacting to the vaccine and you're making antibodies to it, so that's actually a sign that it's actually working. It doesn't mean that you've got an infection. You can't get an infection from this vaccine. The vaccine is not available to the general public. We have had a deluge of calls coming into our call center that have kind of backed up our phone call folks and delayed other kinds of responses. We've put up-to-date information about the vaccine on our website, which is baystatehealth.org, and you can find similar information on mass.gov. But the current estimates for the 3-phase rollout, phase 1, as I had mentioned, including the direct caregivers, first responders, elderly and chronic care settings, home health care workers, that should be completed by February. Phase 2 include individuals with comorbid conditions such as diabetes, high blood pressure, etc., that would put them at high risk for COVID complications. It includes so-called essential workers such as educators, food service workers, utility workers, sanitation, public works, etc., adults over 65. All of these individuals ought to be completed by April. And then as far as the healthy general public, that would begin in April and probably not end up until June. Obviously, if we begin to get other vaccines coming online beyond Moderna, AstraZeneca, Johnson & Johnson, that timeline might be accelerated. But right now, the short answer as to whether or not a healthy person can get vaccine, if they're not a healthcare worker, is not yet. More and more Americans are saying that they would take the vaccine, which is a good thing. We expect that number to grow as other people receive it and people have a chance to talk with their providers. There have been concerns around communities of color, I believe in the city of Springfield, where we have been working with those communities through our inner city health centers for many, many years, that when individuals speak with their providers, that they're going to feel reassured and confident that this is a vaccine that will clearly benefit them. So as I mentioned, the amount of virus in the community and its rate of rise is alarming. I'm still very worried about our ability to meet the demand for care now before the vaccine sequences are completed, even though we're okay at the current moment. What you all can do to help us is to follow the precautions for masking, social distancing, and hand washing. You also should be limiting your visits to indoor spaces where there are people you don't live with, especially if masks are not being worn. I know this is very hard advice during the holidays, but some states have implemented restrictions that are even stronger than those current in Massachusetts. And if the current trends continue, I expect that we'll be heading there too. I noted just over the weekend that Germany put in place some very strict lockdowns, and that's a country that celebrates Christmas more enthusiastically than most. So very, very difficult choices being made across the world. The vaccine is the light at the end of the tunnel. I see most people in public places wearing masks and being careful, and so I appreciate that very much. It helps us a lot. In Western Mass, we've done better than the East and better than many other states, I think because of the fact that people are following this guidance. So please, let's recommit to keeping each other safe. Please try to restrict your activities so that you can make it to the date when you'll be eligible for the vaccine without having to go through the suffering of having this terrible disease. Again, Mr. Mayor, thank you very much, and I'll pass it over to Dr. Bruce now.
Thank you, Dr. Sheryl. Dr. Robert Bruce, the Chief Medical Officer of Mercy Hospital, Trinity Health.
And thank you, Mayor, again for the invitations to be able to address our community on a weekly basis, and thanks to the media for the continued coverage. And good morning to everyone. I also want to wish our Jewish community members out there a happy Hanukkah as we're in the middle of that celebration. In that faith, it certainly is one where it recognizes lights and also the hope for new beginnings. And this has been a very, very eventful and important week in the Commonwealth and across the country, and one that, with the pandemic, I know we are all hoping for some new beginnings, more light and more hope in the coming year. As we've heard, on one hand, we are extremely excited about the authorization and distribution of what is a safe and highly effective novel vaccine. Yet on the other hand, we continue to deal with the rising rates of cases and hospitalizations across the country that could multiply exponentially over the coming weeks or months. I will comment first on the current numbers and the concern, because if each of us don't take additional actions now, and we follow through with those actions over the coming months, there is no vaccine that will prevent the staggering number of deaths that we could see across the country. There have now been 300,000 deaths from COVID directly in the United States in just 1 year, which is more than all of the American casualties in combat during the 4 years of World War II. And from data from the Centers for Disease Control, their estimates are now that actually there are an additional 400,000 deaths that may not have been directly from COVID this year, but were likely impacted by the pandemic in one way or another. We know that because we've seen people delay or avoid care because of the concerns that they have regarding safety. We know that because certain situations have called hospitals and healthcare systems to postpone or delay that care. And now there are hospitals in areas of the country that are overwhelmed with the numbers of COVID cases, which only serves to divert attention away from the preventive and chronic disease management care that is so important to prevent complications and morbidity. We also know this because the impact of the pandemic has had a tremendous emotional and economic toll on people. where individuals who have lost their jobs or have had to stay home to provide child care have also been forced to make the decisions regarding filling their prescriptions or paying their rent. People have also experienced extreme anxiety or isolation, and also depression and grief from the loss of their loved ones. And it's well founded that exacerbations of anxiety and depression can complicate chronic diseases like diabetes or heart disease and lead to worse outcomes and death. So this holiday season, which should remain a time of gathering amongst your loved ones in your household, and the feelings of reflection, must also be a time that we take very seriously, and it remains a critical moment for the health of our country. There have been more than 16 million infections, and there are staggering numbers of new infections, over 200,000 per day and 3,000 deaths per day. And we have not yet seen the peak of this in the United States as this third wave just continues to rise. Here in Massachusetts, as reviewed, the number of new infections has flattened a little bit over the course of the past week, from about 5,000 to about 4,000, but it's still a strikingly high number compared to where we've been and where we need to get to. And perhaps most concerningly, as the number of hospitalizations continues to rise, and as of this morning is over 1,700 across the state. At Mercy Medical Center, we are also seeing our highest number of hospitalized cases since the first surge. Over several days last week and also this morning, we have 32 patients hospitalized, of which 5 are in intensive care. And I want to highlight that we had as many as 8 in our intensive care unit earlier over the course of last week. And while you may know people in the community who have acquired COVID and have recovered, as the vast majority of people do, I want the community to know that we continue to see cases of people with very sick illnesses, with very bad illness that become very sick, and we are still seeing people, unfortunately, die from this disease right here in our own community. At Mercy, we have expanded our testing capacity. We are testing over 3,000 per week, sometimes upwards of 3,500. We are running 4 different platforms, and we continue to see a high test positivity rate between 8 and 9%, so a little bit above the state average, which is showing us that transmission is still quite rampant. So more than anything, and perhaps more than any time up until this point throughout the pandemic, now is the time when we must reinforce our adherence to the public health practices of masking and physical distancing, of avoiding any non-essential indoor contact and large gatherings of people outside your household, and certainly during this holiday season also to consider and would recommend postponing any travel or additional celebrations with those outside your household. This past week, Governor Baker announced a rollback of some of the Phase 3 reopening criteria precisely because of the situation that we're in, and the data essentially all going in the wrong direction at this point. And the Department of Health did announce that hospitals and healthcare providers are to remain very focused on inpatient bed capacity and should postpone and cancel any non-essential care that's impacting that capacity. At Mercy Medical Center, we do continue to have adequate inpatient and ICU capacity. We do evaluate that capacity several times per day, 7 days a week. We are in constant communication with our providers regarding services that do need to be curtailed or delayed in order to preserve that capacity. We do feel very strongly that the care we provide, whether it's for COVID care or non-COVID care, is safe care. We feel very confident also that it's important to recognize that maintaining services is critical throughout this point, as the excess deaths experienced in the United States this year would be a testament to. Delaying unnecessary care can lead to worse outcomes. We've seen it, and the studies do show that. And so if you have any questions about your care or procedures or studies that you may have scheduled coming up, I just encourage you to discuss that directly with your provider. And lastly, at Mercy, we are also very excited about the news of the Pfizer-BioNTech vaccine receiving the emergency use authorization from the Food and Drug Administration last Friday evening for all individuals over the age of 16. I believe this is truly a historic moment for public health. We have a safe, highly effective vaccine that is now going to become available to combat and prevent a deadly infectious disease in under a year from when we had our first confirmed case in the United States. This is without question a very promising and a very important step in this pandemic. I believe also that healthcare workers hold a very special role. We should consider ourselves fortunate and not be shy about expressing that, to be in the first phase of people across the country to be eligible to be vaccinated. I myself feel both a deep sense of gratitude as well as a sense of responsibility, because as healthcare workers, we have a duty, a calling to care for people, and we can only do that if we protect ourselves. So I encourage people, when the time is right, to do and take this opportunity to do that and protect yourself. I'm also proud to say that I will absolutely accept this vaccine the first day that I am eligible, based on our prioritization. I've reviewed the data and the authorization from the FDA, as well as the recommendations from the CDC's ACIP, and I believe it to be of the required safety and effectiveness. And I wish to be among those that will protect myself from COVID so I can protect others, and hopefully be part of a movement of people that will do the same for the benefit of our entire community, especially the most vulnerable. Over the course of the next few weeks, I expect to stand back and be patient, while others who are closer to the risk of exposure, like our providers in the emergency department, intensive care, and inpatient units, are vaccinated first. But I guarantee that I will be there with my sleeves rolled up as soon as there's enough vaccine to broaden our campaign. I was actually speaking to a physician last week who recalled being amongst the first people to step up and volunteer for the oral polio vaccine in the 60s. She had seen a friend of hers die from polio. Back then, there were tens of thousands of cases of paralysis occurring across the country each year. But with initially the injectable and then the oral polio vaccine, the cases began to drop significantly into the double digits and then into the single digits, and by 1979, 0 confirmed cases of polio in the United States. This is an example that the value of vaccines truly cannot be overstated, I should say. The value cannot be overstated. They have protected billions of people over history from serious illnesses. They have saved the lives of millions of people. They have essentially eradicated diseases like polio and tetanus. They have suppressed the rates of infections of so many others, like hepatitis B, pertussis, measles, mumps, and rubella. So much so that we only get concerned now when there are spikes of infections related to clusters or communities that have not been vaccinated. So at Mercy Medical Center, we are ready. We are prepared to begin the vaccination of our colleagues and our medical staff within hours of when we would receive our first shipment from the Department of Public Health. We've developed a large-scale campaign with education. We've created an on-site clinic for people to arrive with scheduled appointments to allow for both the adequate physical distancing but also the periods of observation. We've already invited colleagues to schedule those appointments for this week, and we expect that upwards of close to 1,000 colleagues will get vaccinated by the end of this month with their first inoculation and then have scheduled for their second. We look forward to expanding that as soon as we have the ability and the resources and the supply of vaccine to do so. And I look forward to the day when we can think of COVID-19 much like we think of polio in this country, as a memory. This is a landmark moment, but as we've talked about, we still have a long way to go for our entire community and our country. So this holiday season, can please continue to be well, to stay safe, and to help us get there. We are here for you, so please continue to be here for each other. Thank you.
Thank you, Dr. Roos. And I'll bring up Dr. Kerouac, Dr. Roos for any questions. Heed their advice, and Commissioner Helen Cotton Harris. These conspiracy theories, these are the medical experts. And the analogies that Dr. Roos and Dr. Kerouac make should go right head, heart, gut, and mind of all the challenges that faced us before and how they've been conquered by vaccines, not by conspiracy theories. Questions for Dr. Kerouac, Dr. Roos?
Dr. Sheryl, how many doses of Pfizer vaccine do you expect to receive?
I've been asked not to share that. I think it will be below what we need, and we're going to wait until we actually have it in-house to disclose that information.
So Boston Medical Center, I think it was 1,900 this morning, apparently they're the first hospital in the state to receive a vaccine.
Yeah, they're roughly the same size as we are.
Okay.
So the Pfizer vaccine, as you know, comes in shipments, typically about 975 doses. We expect to receive one of those shipments from the Department of Public Health in the coming days.
And could you just go over the time frame again for how long you think it will take? Now, obviously, there's another vaccine you think the pending FDA approval sometime this week. Can you just go over the time frame of how long you think it will take to have your frontline staff, the people who need to be vaccinated?
To get the 2 shots would probably be toward the end of January. There is some protection, maybe 50, 60% after that first shot. So, you know, given that we're going to be staggering, because we don't want everyone to get the side effects at the same time and be out at the same time, it will be a couple of weeks to get that first shot into everybody of the doses we have, and then we'll be giving more as we receive more.
So 7,000 to 8,000 people by the end of January.
Correct.
Yeah, so at Mercy Medical Center and our affiliates here in this market, and we are expecting that we have about 3,000 colleagues or so within that, of which we hope a large percentage, maybe upwards of 80% or so, will be interested in receiving the vaccine. We're on a similar timeline that we expect to be able to give those first dosages certainly by the end of January and complete all colleagues that are interested by the end of February, if not before.
You said, Dr. Kerouac, that people have been calling the hospital wanting the vaccine. So first off, what do you tell them, and do you consider that to be an encouraging sign that there are people willing to line up out there to take the vaccine on both initiative?
I've always expected that there'd be a brisk demand for that vaccine, and we're already seeing national polls show more and more interest and more willingness to take it. What we've been telling people is that it's not available to the general public or even to high-risk individuals who are not in the healthcare space.
That's correct. Yep, that's exactly the
Eric from the
guidance.
Western Mass.
Thank you. The Pfizer vaccine must be kept below a certain temperature. Now, is there any risk for freezer burn?
For the vaccine, you mean? No. No, it needs to be kept at minus 80 degrees centigrade. And I'm not sure, I think that's minus 90 Fahrenheit or something like that.
Yep,
in any event, the vaccine can be maintained for a long period of time at that very low temperature. Once you thaw it out, it needs to be used within a few hours.
Dr. Roos?
No, I would just.
Yep. 22, I saw Nick Oresco here. I don't know if Nick has any questions at 22 at this point. Okay, Matt, go ahead.
Doctors, in terms of what you're receiving as far as the vaccine, is the presumption that all of it is going to be used for the first shot and you're going to get more later for the second one?
Yes.
Yes.
I understand. Yeah.
Yes.
That's the understanding I have from the Department of Public Health, that this can be utilized for the first. They will ensure that there's a supply there for the same number of dosages for the second.
And I've spoken to a number of my friends from other states who are going to trust in the supply chain because there are hundreds of, like 100 million doses that are going to be out there of this vaccine before long. So it will continue to keep coming.
And as you mentioned before that the multiple platforms have kept your ability ability to maintain testing supplies relatively fluid. A few weeks ago, I know Dr. Carwalker said there was some crunch that was going on in terms of that. Is that, are we past that point? Are you confident in terms of like where testing supplies are now, or is it still?
There is continued daily haggling around testing supplies. Orders are late, they're short, and we've begun to diversify our sources of supply in order to deal with that. We also, just as we have in the clinical arena, we are scrambling to make sure we have enough staff, licensed staff, to run the machines, which are running pretty much around the clock. So, you know, it's not as if everything is calm right now. It's a continued scramble, but we're staying ahead of it.
And I know that University is relying principally on the Abbott test for a lot of its testing. And feel free to correct me if there's something that there's still a lot of basic testing being done in-house as opposed to being farmed out. So I have noticed that there has been a delay in a lot of testing statewide. You see that in the dashboard, you can see where tests are coming in. It doesn't seem to be as acute in Western Mass, so I'm just curious if
We have a couple of test platforms which include the Abbott that can give us an answer within minutes to hours. We use those typically for our emergency department patients where we have to make a decision. For patients who are outpatients, we may use a different platform, and in any given day, a couple hundred will be sent out. More and more now we'll be sending out to UMass Amherst, which should be a one-day turnaround. If indeed we were to send it to some of the commercial labs, that might be a 3 or 4 day turnaround, which is which is still shorter than what they're seeing in other states. We generally have preferred to limit our send-outs to places like MIT or UMass, where we know we're going to get the 1 day turnaround.
And at the risk of kind of jumping into too many of the details here, we have the 4 platforms that are in place at Mercy. 2 are Abbott platforms. One is the ID Now, which provides a more rapid test, which is a molecular test but not a PCR test. And there really have not been any concerns with supplies for that once we went live. The workhorse of our testing since the beginning of the pandemic has been the Abbott M2000, which is a PCR test that takes about 8 hours to return. We have had adequate supply essentially throughout the pandemic for that. The areas where we have been crunched at many times have been our platforms that return PCR tests within an hour, which are the Cepheid platform and the BioFire platform, particularly the Cepheid. And so there have been times where we've had to limit that to just a couple dozen per day, when in reality, if we could utilize that more, we would have quicker results for, you know, the gold standard test. At this point, we are able to do most of all that testing in-house. But it is, as Dr. Carwalker has mentioned, something that we are constantly working on the supply chain to make sure we have adequate reagents and supplies.
Dr. Carwalker, I'd like to ask you a slightly off-topic question. I know you've been vocal about the surprise medical billing situation. There was an agreement announced on Friday in Congress on that. Do you have any comment on it?
I've not reviewed that solution, so I don't have a comment about that.
Thank you.
Any other, Eric, go ahead. Western Mass News, Channel 40.
How many healthcare workers are working directly with COVID-19, and how are you determining which employees get the COVID vaccine first?
Well, as I mentioned, we have 7,000 to 8,000 direct frontline caregivers. There are some who work intensively on the COVID-only units. On the other hand, though, there are employees who will occasionally encounter a COVID patient. Let's say a COVID patient is having a baby, or a COVID patient is being cared for on a unit in one of our community hospitals where part of the unit is COVID and part of the unit is not. So the people on the COVID specialized units would be the ones going first. Those would be the first units going first. And by that I mean not only just the nurses and the doctors, but also the environmental workers, the food service workers, the translators, etc. Everybody on those units gets vaccinated, and that would be the first priority before we would move to other units where just occasionally they see a COVID patient.
Dr. Russo?
A very similar paradigm we're following at Mercy Medical Center. We have about 1,200 colleagues that are working directly or indirectly in areas with a high exposure risk to COVID, so emergency departments, ICUs, inpatient units that are dedicated to COVID, outpatient clinics that are dedicated to COVID, colleagues that are doing testing on people at a high degree of regularity, our infectious disease and infection prevention folks. So there's a wide range that we are focusing on first. But we expect that we will have enough vaccine over the course of the next 6 to 8 weeks that all colleagues, direct and indirect care that could have a risk of exposure to COVID and meet those CDC criteria will be offered.
Any other questions or comments from the media? Yeah, Paul, go ahead.
Just quickly, I mean, obviously, the arrival of the vaccine is great news, but in the short term, it's not doing anything to drive down the number of sick people who are showing up at the hospitals, right? I mean, what can be done short of what we're doing now or not doing now to try to reverse these trends that you're so alarmed about?
The only effective ways to mitigate the growth in the numbers of COVID are the things we've been talking about since day one. Masking, social distancing, hand washing, limiting indoor activities. That's all we've got right now. I mean, everything else that we've got is treating a case once it's happened. But in terms of prevention, it's this old-fashioned quarantine separation stuff that's been around for 100 years. That's why the vaccine is such a breakthrough. So it's not like there's any new strategies to limit the spread.
The only thing I will just add is we've talked a lot about the vaccination of healthcare workers, which is essential because we have our colleagues that are there to care for patients and need to maintain capacity. But there is also going to be, in the very near future, the vaccination of residents of long-term care facilities, those that have fallen to the other high-risk groups, homeless, congregate care, etc. And that is also, in parallel, a critical strategy to help protect the most vulnerable in the community from disease or death and potentially reduce some of the transmission. The ability to do that in parallel, I think, could have the potential to start to see some impact, but it really won't be, as Dr. Kerouac mentions, until we have many, many more groups vaccinated where we'll really start to see a significant downward trend.
Any other questions or comments for Dr. Kerouac, Dr. Roos? Okay, gentlemen, thank you so much. Again, heed their advice. Conspiracy theories don't stop medical challenges. Vaccines do. Thank you, gentlemen. Stay healthy. And to you and your staffs, thanks for all your dedicated efforts. We'll now bring up our Dr. Anthony Fauci, the Commissioner of Health and Human Services, Helen Calton-Harris.
Thank you, Mayor, and as always, thank you for your support. I am going to begin with the data. The data is before you, but I'm going to start with the number of cases that we had in the city of Springfield last week. I'll start with the number of confirmed COVID-19 cases on Sunday, 179, Monday, 138, Tuesday, 204, which was the highest day of last week, Wednesday, 145, Thursday, 153, Friday, 129, and Saturday was 84. The 3-week total in terms of what we were looking at the week of November 22nd was 675. The week of November 29th, 1,168. The week of December 6th, 1,033. And as the mayor indicated, that was 135 cases less than we saw the previous week. If we look at the confirmed COVID-19 cases weekly comparison, as you can see, the numbers were all over the place for the last 3 weeks, but I will point out that 296 that we saw last Saturday, and fortunately we did not repeat that number or anything close to it last week, which was good news because that was a staggering number for one day. Looking at the cases by age, as you can see, the 0 to 10-year-olds, there were 84 cases. 11 to 20-year-olds, 152 cases. 21 to 30, 181 cases. 31 to 40, also 181 cases. 41 to 50, 163 cases. 51 to 60, 144 cases. 61 to 70, 82 cases. 71 to 80, 32 cases. 81 to 90, 9 cases. And 91 to 100, 5 cases. The 30-year-old and under last week was 41%. That is a decrease of 3% in that age category. The 31 to 50, 33% last week. That is an increase of 2%. The 51 and older is 26%. That was an increase of 1% from last week. Looking at the zip codes, you can see the numbers for the zip codes: 011, 013, 03, 17, 04, 188, 05, 91, 07, 86, 08, 196, 09, 232, 18, 68, 19, 50, 28, 12, 29, 47, 51, 43. The cases by zip code by percentage: 01101, 0%, 01103, 2%, 01104, 18%, 05, 9%, 07, 8%, 08, 19%, 09, 22%, 18, 7%, 19, 5%, 28, 1%, 29, 5% of the cases. Looking at the cases by race, the unknown, again, the unknown is because there was no race indicated next to the individual's name, is 31%. Asian, 2%, Black, African American, 19%, Latinx, 22%, and white, 25%. That is the data from last week. The cases in Hampden County, 20,240. The deaths in Hampden County, 962. City of Springfield cases, 8,763, and as you've heard, that was 135 less than last week. The City of Springfield is recording 147 deaths. The average age of hospitalizations in the Commonwealth is 69. The average age of deaths is 82. The mayor has given you the numbers as 63 white, 48 Hispanic, 32 Black, 4 Asian, and 89 were in residential, 58 in long-term care facilities. When I took a look at the deaths by month, when I went back and looked, April had 71 deaths. Now, I suspect that that included some deaths that we had in March, because March recorded 1 death, April 71, and then May we had 42 deaths. We are beginning to see an increase in our deaths. July was 5, August 2, September 1, October 1, November 12. And already in December, we're seeing 3 deaths. And so what we are seeing is an increase in deaths in our city and certainly across the Commonwealth and nation. Last Wednesday was a horrific day for me in the Commonwealth of Massachusetts, and perhaps one of the most emotional days that I had since I began reporting the numbers. 89 people died last Wednesday in Massachusetts in one day. I had never seen that kind of number of deaths in the Commonwealth. For the nation, that number was over 3,000. But as I looked at those 3,000, I thought about the fact that 89 of those individuals belonged to the Commonwealth of Massachusetts, and that meant that there were families grieving, there were individuals who are just suffering. And I sat on my couch and I was paralyzed. I was paralyzed because emotionally I thought about those individuals in our community who are suffering, scared, who need relief, who need a hug, who could not be with their loved ones as they transitioned. And so we know that this surge is going to continue well into the new year and is going to impact our holiday celebration. The majority of our cases are still found in gatherings, large and particularly small, individuals in households, and I know that because we have in the Board of Health the addresses, and so I can look and see that these cases really are individuals not heeding the concerns of public health and are still gathering. The governor's rollback does not majorly impact the city of Springfield because we never went to phase 2 of step 3. And so our guidance will remain primarily the same. We continue to trace, test, isolate, and quarantine. We continue to ask you to answer your phone for our contact tracers. Contact tracers is still a very valuable and necessary part of our public health response. The testing AMR labs has tested in total 74,916 individuals. 32,095 of those are Springfield residents. The total number positive from AMR is 5,917. They have said that they will not be testing next Wednesday, Thursday, and Friday. So it is important that you do understand and acknowledge that they will not be at Eastfield Mall. The materials, I have heard from individuals who are concerned that they have not been reached out to by the Board of Health. We have, and I have announced each Monday, that we do have materials in the department in languages, and we look to hear from our neighborhood councils. If you would like some materials, they look like this. They are in several languages. We are more than happy to get the materials to you. We do not at this time, because of community spread, have individuals going door to door. There are neighborhood ambassadors that do have tables. They are from the Commonwealth of Massachusetts, where they are handing out materials. If you need face coverings, because, and I'm speaking specifically to neighborhood councils, if you need face coverings and would like us to help you with that, we are more than willing to do that as well. Things are going to get worse before they get better. Let me repeat that again. Things are going to get worse before they get better. You have heard the wonderful news about the vaccine. We are all excited. We cannot wait to get the vaccine so we can begin to see some relief from this terrible, terrible, highly contagious virus. But right now, the vaccine will not be available to the general population until April or potentially May. And so until that time, we need you to do your part, as both doctors from Bay State and Mercy Medical Center have said to us. We are fortunate to have two hospital systems that are fully capable of making sure our residents are cared for, but they need help. Their healthcare workers who are there every day need our help. They are fatigued and tired and are on a daily basis watching residents and individuals die. And that takes an emotional and physical toll on their health and their family's health. So I'm asking you to watch your distance, wear your mask, do not gather in groups outside of your immediate household, and wash your hands. It is important that we do these things in order to mitigate this virus. It's important, and I'm asking that you do that. The holidays are coming. Another holiday is coming, I should say, and so our concern continues to be around the Christmas holidays, around New Year's, and we're again asking not to take any of the mitigation lightly. Make sure that you are taking care of yourselves, the community, and your family. The data now indicates that 61% of Americans will take the COVID-19 vaccine if offered. That is not enough. We need all of us to be in this together in order to mitigate the spread. And so, as the physicians have said to us, the data has been examined. We understand that this is a safe vaccine. We want you to listen to your healthcare provider and those trusted voices in our community. I certainly understand some of us certainly have some prejudice against taking vaccines. We have some prejudice often about listening to our healthcare system because of perhaps a past experience. But it has been said that vaccines work. We know that because of polio. We know that because of measles. We know that because of diphtheria. We know that because of viruses and bacterias that have been mitigated with vaccines. So we're asking that when the vaccine is available for your category, that you do take the immunization. Hopelessness, powerlessness, loss of control, all of us are feeling that at this moment, but we do have some power. We do have the ability to control this terrible virus. And that has been said to you over and over again. It has been a season of difficult decisions for our Board of Health and for our mayor. We have had to scale back the Toy for Joy process as far as giving is concerned. We have had to scale back many of our celebrations and make difficult decisions and say no. We cannot allow you to do that based on the community spread and this raging virus. But I'm going to ask you to please support toy drives in the way that you can, monetarily, or if there is a safe drive-through, that you participate in that. The other area, I spent some time just observing food lines. And I have to tell you, I could stand here now and actually cry as far as what I saw. Families with children who talked to me about being hungry and not knowing if they were going to have enough food on their shelves, not knowing if they could feed their children. The one savings grace that was told to me was around Springfield Public Schools, who were handing out meals. Our residents were so grateful for our ability to feed them and their families, but the lines are long. People are weary and worried. How am I going to feed my children? Do I pay for medicine or do I feed myself? These are real challenges for families. It is not something that any of us should take lightly. The mayor has indicated that our federal government, our elected officials at the federal level have a responsibility to take care of their constituents. And so we need to stop the nonsense and make sure that we are passing legislation that gives relief to our family. Food insecurity is raging. Prior to the pandemic, 1 in 10 Americans experienced food insecurity. Today, that number is 1 in 6. I want you to walk down the street, see 6 people, and know that one of them will go home that night and will not have enough food on their shelves. I'm asking you to help where you can. There are these varied emotions that we're all feeling. They bubble to the top for me at the number 89 last Wednesday. They bubble to the top for many of our residents consistently because they're facing it every day. We are doing what we can from a municipal level. I would ask each of us to do the same. I want to also thank those individuals who participated in the clinical trials. I'm not sure we thank you enough. Those individuals across the nation who rolled up their sleeves and became the individuals who provided the data on which we rely, on which we have moved forward to get the emergency use authorization for the vaccines. Dr. Kerouac has talked about the phases. The phases can be found on our website. The phases can be found on dphmass.gov website. But it's clear that the individuals who the general public will be phase 3. And so it is important that we take care of our frontline workers, our healthcare workers, those in congregate living surroundings. That is very important that we move forward, make sure police, fire, and emergency medical services are taken care of. They are also in phase 1. In phase 2, individuals who have comorbidities are in phase 2 as well. DPW workers, I believe, are in phase 2 as well. So go to the website, look at the phases so you can be educated around where you are and your family and those in your environment as far as vaccines are concerned. The vaccines are not here yet. They are not available for general public, I should say, yet. Until that happens, we need you to think about protecting yourselves and your families, wearing a mask, washing your hands, watching your distance, avoid congregate living situations to the degree you can. And by that I mean having individuals come over to your house who are not a part of your immediate family. The mayor continues to say we will get through this together, and I certainly believe that, but we're not going to get through this together unless we all pull together. And I'm asking us at this point, please pull together. We will continue to provide you the data. We will continue to provide you the information, and I do not stand here and give you the data for the sake of giving you data. I want you to see yourselves in this virus. I want you to understand that it is impacting your neighborhood, your age group, your community. I want you to hold the mirror up and say, this is me. This could be me. I could not be making it through this terrible time unless I do what the public health professionals ask. Look in the mirror. Look at the data. That's you. That's your neighborhood. That's your age group. That's your race. That's your ethnicity. Please Take care of yourselves, and let's take care of each other. Thank you, Mayor.
Thank you, Commissioner Carlton-Harris. Thank you very much, Helen. We'll now move to the public safety portion of the update, and we'll start out with the Fire Commissioner of the City of Springfield, Bernard B.J. Calvin.
Good morning, everybody. Thank you, Mayor. As the Mayor stated, we have 16 positive cases currently in the fire department. I anticipate 6 of those 16 coming back online this week. They're at the end of their quarantine period and are feeling better, so hopefully we'll get their clearance this week to come back to work. We have 16 people awaiting testing. Those of people who have had close contact or been exposed to COVID, they're out in a quarantine period now awaiting testing on those people. At the dispatch center, we have had 2 positive cases, though they are both out of work, and they are beginning their 14-day quarantine period now. So that is the COVID situation in the fire department and in the dispatch center. It has not affected our operations at this point. We are up and running. We are answering calls, so that we're on a good footing there. As the Mayor stated, we've had several fires over the past week, kitchen fires and small electric fires. I'd like to remind everybody in this Christmas and holiday season, please be careful with extension cords and plugging appliances into extension cords. That creates heating and undue load on your electrical system, and that could cause a fire. The other issue is everybody needs to be careful. I know everybody's starting to get ready for the holiday, doing some holiday cooking, holiday baking. Please be careful in the kitchen. Don't leave any appliances on. Don't do any unattended cooking. That can lead to a disaster right before the holiday season. And lastly, some Christmas tree safety. Make sure you're keeping your tree watered. Make sure you're not leaving it plugged in all the time. When a Christmas tree burns, it's like a gasoline fire inside your house, and they go very quickly. I've been to fires before that have involved Christmas trees, and the tree has actually burned a hole right through the living room floors or through the whatever room they're in and dropped right into the cellar and caused a cellar fire. So please be careful with your Christmas trees. Make sure they're watered. Don't leave them plugged in. And everybody have a great holiday. Thank you.
Thank you, Commissioner Calvin, for that important information. I will now move to Commissioner of the Springfield Police Department, Commissioner Sheryl Clapper.
Thank you, Mayor. As announced, we're down 21 officers, 14 are positive, 7 are awaiting test results coming back. I'd like to thank the women and men of the Springfield Police Department and their due diligence with what we've prepared for, making sure they wear their PEPs, the cruisers are being cleaned out before every shift, the rooms are being cleaned out. I thank Pat Sullivan for the ventilation machines that are now in the department and cleaning out every room that we have a positive. And I think what's happened, probably same in fire, what's happened in the police department is as I lose officers who test positive to COVID, it's not because of the environment they work in or calls they've been on. It's been private gatherings and things that have happened off duty. And because we've been careful about their work environment, it's worked out to where as I lose officers, they come back before I lose more. So we've been able to keep proper manning in most cases, and I think that's because of the work ethic and the consciousness of the employees in the department and the officers themselves as far as their own cleanliness, masking, and cleaning of the cruisers. So I think we've done a good job to make sure that Springfield always has an adequate police force on the streets. Over the weekend, Sunday at 10:30 a.m., it was the Metro unit that made 2 arrests, seized a illegally possessed loaded firearm. We've been concentrating in the Fort Pleasant area, Belmont area. We arrested 2, a 20-year-old Derek Stinson and Ali Ali. Mr. Ali has an open firearms case out of Dudley District Court, as the mayor mentioned. Mr. Stinson has some active and open narcotics cases. So far this year, as of today, we have seized 198 illegal firearms in the department. That's department-wide. Also, as far as the police department goes, there's been some armed robberies as of late, especially over the weekend, and Chicopee had one. I think you're going to see from my press information officer, Ryan Walsh, there'll be a release today. We're asking the public's help to identify the person involved. In some cases, it's 2 people involved. We have some good footage, videos. Captain Duda told me this morning that because of the weekend, a lot of these businesses can't produce the video to us. So Cumberland Farms and another gas station came through this morning. So you'll see a press release. We're looking for help to identify this man before someone gets hurt. Thank you.
Thank you, Commissioner. Thank you, Commissioner Clapper. We'll now move to the school component, and Superintendent of Schools, Dan Warwick, Springfield Public Schools, will now speak for an update.
Thank you, Mayor. Morning, everyone. Great news this week on the meals front. We're going to exceed 5 million meals this week since school shut down in March. This weekend we delivered 103,108. We're at 4,836,374 meals. So, congratulations to Sodexo and the school department team on really doing a great job in a community that has considerable food insecurity in the best of times, and these aren't the best of times. Town hall meeting, we had a very successful town hall meeting in August with the support of the mayor. We're going to have another one tomorrow night at 6 o'clock with the help of Focus Springfield, focused on school reopening. We're going to have translation in 6 different languages available so we can get feedback from the community relative to what they want to see in our reopening plan. The school committee will be voting on December 17th after the town hall meeting and getting that feedback on what they want to do relative to school reopening. We're continuing to work with Pat Sullivan in facilities and O'Reilly, Talbot, and Oaken to take a look at the ventilation systems in all of our buildings. We're doing a complete analysis and beginning to make all the repairs necessary to reopen safely and exceed the ASHRAE standards and meet the kind of standard we'd like to meet, when you're dealing with a COVID situation. So, we're working very closely with Pat Sullivan, who's been great on that, and Helen has been guiding us through too, and we're so grateful for that. Flu shots are still available, and our students need to get the flu shots prior to January 1st in order to return to school. Winter sports have been delayed into early January. They usually start right after Thanksgiving, but the school committee did approve basketball and swimming, again working with our health commissioner and testing all of our students first. So contingent on that testing, we're going to try to give our students the opportunity to participate. MCAS, the commissioner has delayed any January administration of MCAS or access testing for our ELL students until the spring. We're hoping, along with all the other superintendents and the Mass Association of School Committees, that DESE is wise enough to suspend those tests for a year and not hold graduation contingent on that testing. As you know, we did get hit by a virus. We have put systems in place to respond, and all of our systems are back online. They weren't able to get into any of our main systems, but they did get into some of our secondary systems, and any employee whose information may have been impacted has been sent a letter and offered free credit monitoring. Since we opened school, this is another piece of good news. Our attendance online has been 91.5%. So our kids have been really working hard at it. Our staff has been working hard making sure that we put everything in place to keep everyone online and everyone learning. The Department of Elementary and Secondary Education has just put in new student learning time regulations for students who are remote or in a hybrid program, and analyzed Springfield's plan and said we actually exceeded the requirements, so we don't have to make any adjustments to meet the new student learning time regulations. And for parents and students, again, we have a helpline that we hired out for a third-party vendor, and the number's on the website, so anyone who has difficulty with the technology can go on that helpline for help. Thank you. Thanks, Mayor.
Thank you, Superintendent Warwick. We will now have the Director of Department of Public DPW, Chris Signoli, come up. And again, we're very appreciative and thankful of the patience the residents continue to show pertaining to the leaves and the phenomenon that's going on throughout the Commonwealth on snowplow drivers. We're still in need. We'll be prepared, so your patience again is welcomed if we do get this storm, but it looks like that we are going to get somewhat of a storm. We don't know, depending how much it could be or not be, but we are going to take a hit. The Director of Department of Public Works, Chris Signoli.
Mayor, thank you. At the DPW, we are short 8 employees due to COVID. They were out all of last week and expect some of them back this week. However, we are waiting test results to that. As was mentioned before, I think by BJ, all of these came from the home settings. None of them were spread within the office. We have caught up a little bit on the yard waste. We are a little bit less than 2 weeks behind. We have numerous crews out there today. We've taken all of the operations staff and moved them into the solid waste side to pick up yard waste this week. All construction will cease on Wednesday of this week. And as the mayor mentioned, we are expecting a snowstorm Wednesday night into Thursday. The one thing that I will say is once we start that operation, we will be working with the police department on ticketing and towing. And while there is less traffic on the roadway these days, that means more people are staying at home, which means they're parking in front of their homes. We're going to make sure that through all of our notices that we can get as many people off the street as possible with that. And as was mentioned before by Dr. Kerouac and I know by Helen, our crews fall into the latter part of phase 2 for the vaccines, and I know my employees basically 100% are looking forward to getting the vaccines and keep working. I wish it was earlier, but they are all looking forward to it. With that, thank you, Mayor.
Thank you. Thank you, Director Signoli, and to your men and women of your crews and your catch-up efforts. We appreciate that. Director Pat Sullivan is here. Obviously, he heads facilities and parks and has done a tremendous job in working with all our departments to keep us clean and safe. Director Pat Sullivan.
Thank you, Mayor. We have 6 out due to COVID. We continue to monitor all appointments at both Tapley Street and City Hall. So if you do need to do business at these 2 facilities, continue to reach out to the departments to schedule your appointments. We've completed all our cross-training of all facility staff, so they are doing a tremendous job across the city. They are installing the I-Waves and the carrier units. And I have to give a special thank you to John Kerrigan. He's been invaluable during this process of engineering the install of these systems. We are working with the city finance team to complete all orders for PPE and cleaning products for the buildings to get us through the remainder of this fiscal year. Mayor, thank you for your support and giving us all the resources we need to complete this work. And last, I just want to thank Eversource, Joe Mitchell, and Mike Vitavelli. They've been tremendous in giving us the support we need out in the field, especially at the 4 older buildings that we are contemplating putting the I-Waves and the carrier units. They had teams working with us for the past 2 weeks to engineer the electrical systems to support this new technology in our school buildings. Thank you.
Thank you, Director Sullivan. Again, as I always say, Springfield's in the business of doing business, and Chief Development Officer Tim Sheehan. His team done a tremendous job. We're hoping to get more money from the federal level, because as soon as we get it, we will dole it out to our businesses and residents. The Chief Development Officer of the City of Springfield, Tim Sheehan.
As the mayor referenced earlier, the Harvard University's Opportunity Project indicated that as of November 25th, the most recent date for which data is available, the small business revenue in the state of Massachusetts was down 47%. It's consistently hovered between 40 and 50% throughout the pandemic. Update on Mass Growth Capital, the state small business grants. As we indicated at previous press conferences, that there was $50 million made available by the state. In terms of grant funding, as of their last day of accepting applications, they had 10,000 applications filed. 37% were for programs, were for businesses that had fewer than 5 employees. Generally speaking, it's my understanding that the industries most affected by the pandemic were the ones that were represented in the application pool: restaurants, beauty and personal care, educational, and personal services. It remains unclear how many will successfully get grants, but it's encouraging that Mass Growth Capital has made it clear that the priority is businesses owned by women and people of color, as well as those in gateway cities. It's also interesting that Boston's talking about putting into an economic development bill a program designed to assist restaurants that have been impacted by the pandemic. And an update on the CDBG CARES Act funding. The city has roughly $1.7 million remaining, and that's about 18% of its total CARES Act. So we are in need of additional assistance, as the mayor indicated. Thank you.
Thank you, Tim. Thank you, Director Sheehan. And again, I know it's the back office stuff that's done. I appreciate Attorney and Labor Director, HR Director Bill Mahoney, who was briefed early this morning, and Facilities Sister Ed Pakula and TJ Plan on finances, so they give me their update, which I had indicated. At this point in time, I will open it up to any questions pertaining to my cabinet heads and or myself, and I really want to thank again the media, the TV media, the radio media, the print media for being here faithfully every Monday and getting out this important and pertinent information to our residents and our business community pertaining to programs and health, and also the message of hope, because we will defeat this COVID-19 and we will get through this together. So we'll take any questions or comments you might have pertaining to cabinet heads or myself, if there are any. Okay, seeing that there are none, we wish each and every one of you a continued happy and healthy and joyous holiday season. Merry Christmas, Happy Hanukkah, and Happy Kwanzaa. And please adhere to the advice that was given, especially from our medical professionals, Dr. Kerouac, Dr. Roos, Commissioner Helen Carlton Harris. Some things might seem very simple in nature, but if done correctly, they make a huge positive impact on being preventative and stopping the spread of COVID-19. So with that, go out and have a great day, good health, and God bless. Thank you very much.